This is actually a very interesting analysis. Of course, it's retrospective. It's using Medicare claims data, fee-for-service claims data from one of the large available databases. But what it's really telling us is very interesting. One, the median duration that patients stayed on Ruxolitinib is strikingly similar to what we saw in the COMFORT trials. There we saw between 3 and 3.2 years, here is 3.1 years. Median follow-up, by the way, for this study is about 4 years. It was good to see that patients got started on Rux fairly early, like in about median 4.5 months from diagnosis, which is excellent because we know that if you start Rux early, within 12 months of diagnosis, you have better survival and generally better response rate. So that was good to see. And then one thing that was really intriguing is that, we have this sense that Ruxolitinib is not a good drug for anemia, in fact causes anemia. That's actually extremely well known. But what was seen in this study is that of the minority of patients who were transfusion dependent at baseline, many of them actually became independent at the end of 1 year. So the only way I would explain that is we know Rux does not necessarily help anemia per se. In fact, it causes some, like I said, but one would imagine that because of spleen reduction and overall disease improvement, that the anemia got better in these patients. So I think from those perspectives, one, it gives us increased confidence about the duration of Rux, same as in the COMFORT trials, like I said. It was good to see the early initiation, and it was a pleasant surprise to see that some of these transfusion-dependent individuals were able to become independent.